Welcome, everybody. This is Denise Solzbach. Welcome to the System of Care Leadership Learning Community for this month. Each month, Beth Struhl and I host. Welcome again this month. Today, we are joined by Kristen Looper. She is with the SOAR Technical Assistance Center, and we're going to learn more about SOAR for Children, which is a really exciting opportunity for all of your system of care communities. As many of you know, and you'll hear from Kristen more today, SOAR was originally designed for adults, has been a very successful program for years now, and the TA Network partnered with the SOAR Center last year to adapt to the curriculum for children. So as you know, the System of Care Expansion Leadership Learning Community is hosted by the National TA Network for SAMHSA. Our learning community meets each month. Many of you, as I noticed in the chat box, are regulars, so to speak, who come and join us each month, so thanks again for coming. This is a monthly learning community. It's for system of care grantee directors, coordinators, leaders in states and communities, tribes and territories without grants, leaders in content areas such as family, youth, cultural and linguistic competency leaders. This series is intended to highlight areas of opportunity for leadership as well as help you operationalize system of care in your communities. We do encourage you to use the interactive chat box throughout the webinar. We're going to use this for questions. We'll try to answer questions as they come up. However, we will make sure that they're moved over to the presenter chat and that we do address all questions before the end of the webinar. Our series this year is going to continue. We're going to continue to focus on operationalizing system of care. Some of our offerings will include the financing landscape with a focus on Family First implementation and opportunities under that Children's Bureau initiative, as well as social marketing and announcement of our Awareness Day for the year. And we also will include an opportunity to engage with family and youth leadership from Youth Move and FREDLA, again, to hear how communities across the nation are really operationalizing family and youth leadership and engagement. Our series is also continuing this month with some office hours done in partnership with our cultural and linguistic competency friends. That will be in the form of 2 office hour learning community type of opportunities. So it'll be on October 31st and November 7th, and Tiara is posting in the chat box, and I'll be sure to send it out in our follow-up email. These are office hours that you can call in and ask for any support you may need in either developing your behavioral health disparity impact statement. However, I'm looking at the list here, and I see that many of you have already submitted. So you can also use that opportunity for any implementation issues that you might want to discuss with our experts. I also want to remind you that we do really value your feedback, and we'd ask that you stay on the line to complete the evaluation survey at the very end of the webinar. So the purpose and objectives of today's learning community is to really share the importance of the Supplemental Security Income benefits for children and their families, learn about this exciting curriculum that's going to be launched in, I believe, 2 weeks. It's being beta tested now, and really offer opportunities for leaders across the nation to get involved with SOAR for Children. And with that, I'm going to turn it over to Kristen. And thanks again, Kristen, for joining us.
All right. Thank you, Denise. Yes, we're so excited. I just want to thank you all for joining us this afternoon and learning a little bit more about SOAR for Children. So for those of you who this is totally new to you, that SOAR is a new program. So SOAR is SSI, SSDI, Outreach, Access, and Recovery. And we say, this is a model for assisting eligible individuals to apply for Social Security Administration disability benefits. But really, I think we should switch this up a little bit and talk about it as a tool for wellness and recovery, because we do help individuals access disability benefits, but we do that as a means to an end, that we're really looking for how we can support people in their wellness and their recovery and their stability in housing. So we're really focused on individuals and families who are experiencing or at risk of homelessness and who have a serious mental illness, a co-occurring substance use disorder, or other physical disabilities. SOAR, as an initiative, has been sponsored by SAMHSA in collaboration with the Social Security Administration since 2005. And currently, all 50 states and Washington, D.C. Participate at some level in the initiative. So like Denise said, we're talking about SOAR for children this afternoon, which we are so excited about this expansion into the children world and to have resources and a training curriculum that focuses on SSI for children because it's really been a need in the community, and with SAMHSA support, we've finally been able to develop that, and so we're excited about making that available. So I wanted this afternoon to go over a few basics about SSI for children, just so that we're all talking kind of on the same page. There is a lot of misinformation and myths out there about these programs, mostly because they are very complicated. And so we'll talk for just a few minutes on the basics so that as we talk about implementing this program, why it's important, we can all be thinking about, who this actually applies to. So SSI, or Supplemental Security Income, many people know that adults are eligible or may be eligible, for SSI or SSDI, which is Social Security Disability Insurance. Well, children can also be eligible for SSI based on their own disability as well. And the benefit is for low-income individuals. And so when you think about SSI for children, you think that the child is the applicant, and you're looking at the child's disability and also the child's income, living arrangement, and family resources. And so depending on a child's living arrangement with whom they live, sometimes a parent's income is deemed, or income or resources are deemed to the child. So there's this large kind of complicated picture of how Social Security determines whether this child meets these income and resource limits. But ultimately, we've got, lots and lots of resources and information in our curriculum about that. But just so folks have a sense of that we're looking at the child's income and resources, but the family's comes into play, of course. And we're looking at children who are disabled or blind. And if found eligible, there's a federal benefit rate, which is the maximum rate that Social Security pays out for SSI each month. And in 2018, that's $750. We got news of the COLA, and so for 2019, that's going up to $771, which, it's not a huge increase, but anytime we see an increase, we're happy about that because we need that number to go up. And SSI generally comes with Medicaid in most states, so that's the health insurance program that's tied to SSI. So what's the definition of disability for children? It's different than the definition of disability for adults, and so that's something that we focus on a lot in the curriculum is how Social Security is determining how the child's mental health or physical conditions, their kind of diagnosis, is impacting their functioning. And they look at the child's functional abilities compared to the functional abilities of a child of the same age who doesn't have physical or mental impairments. So it's a slight kind of turn on that definition of disability for adults, where we're looking at an adult's ability to work, but for children, we're looking at their functional abilities compared to other children of the same age. And so the way that Social Security kind of takes a child through their determination process, they actually do look at work for children, but for a lot of children, this is not applicable if you're, working with a child who's under the working age. But they do look, so is the child working at what Social Security defines substantial gainful activity? These are monthly earnings per month, so it's the same number for adults and children. So that monthly amount is $1,180 a month this year. That's going up to $1,220 next year. But they say, is the child working, earning that much? If yes, they're not disabled according to Social Security's definition. But if no, and for most younger children it will be no, they look, does the child have a severe impairment? And if not, they would be denied. But if, yes, they have a severe impairment, they go on and they say, okay, does this impairment meet or medically equal a listing or functionally equal to listings? So Social Security has defined what is a level of severity for a number of mental and physical conditions. So they've organized these listings by body system and tried to spell out what that severity level looks like. And this is kind of a guide to, both their disability examiners and, people in the community and applicants to see, what Social Security is looking for in terms of medical evidence, severity level, all of that functional information. And so we teach in the curriculum how we provide the evidence needed to show that the child's impairment actually do meet or equal or functionally equal these listings. So spend a lot of time on that. So I think the big thing is, I'm getting a little in the weeds here, but to get back out of them, I would say what we want people to understand is that this disability determination process for children, it's bigger than just a child having a diagnosis. It's bigger than just a child having an IEP, and that we really have to look at the severity of that impairment and how it's impacting their functioning. And so we spent a lot of time talking about how to do that and how to describe that and how to provide that evidence to Social Security. So like I was saying in kind of my introduction, that we really see SSI benefits as and access to Medicaid, a foundation for recovery, that it's much more than income, that it's access to health care and housing. It can mean increased education and employment opportunities. It means a decrease in incarcerations and hospitalizations with that stability that comes with it. So we really see SSI as just one brick in a foundation that can bring people to wellness and recovery, including children and their families. In addition to the benefit that it brings to children and their families, it's also helping states and communities. So SSI and Medicaid are bringing federal dollars into states, localities, and community programs, and so we see health providers that can recoup the cost of uncompensated care. We see states and localities recoup the cost of public assistance when they get people off of general assistance or TANF and onto SSI. And then we also just see in general for the local economy, those cash benefits and back payments that are received by individuals are spent locally. And the impact that we've been able to calculate, just from SOAR, and mostly so far SOAR for adults, but if you kind of calculate out the income that's brought in by everyone who's been served by SOAR, in 2018 alone, it was $406 million. So it can make a really huge impact on communities. So what's so unique about SOAR? We know that SSI and Medicaid can be really important for children and their families, but can't they just get the benefit if they need it? Well, that's not so easy. And so because it's a complicated process and because a lot of people who are eligible for benefits get denied for lots of reasons, we developed this model to make sure that we are submitting quality, complete applications that address all of the eligibility criteria. And we're also communicating closely with the decision makers. So we're communicating with the Social Security Administration and the Disability Determination Services. And we have caseworkers who are trained who are following that process. And they're making sure that those applications aren't lost to the process. And by making sure that they're complete and quality, they're also approved. So we can get applications approved and approved quickly because of that kind of ongoing communication. And historically, this has been, a big challenge for Social Security, serving people who are experiencing at risk of homelessness, because it has what's historically mostly a paper process, and in many ways still is, that communication via mail or via the phone, and now even communication online can be very difficult for individuals experiencing homelessness. And so having SOAR-trained caseworkers in the community helping people navigate that process makes such a huge difference. So over the last 12 years, SOAR providers have helped 45,137 people access Social Security disability benefits because of SOAR, which is really incredible. So it's 39,000 that were approved initially, and another almost 6,000 that were approved upon appeal, which is a wonderful impact. We just calculated our 2018 outcomes, and we've been kind of holding pretty steady around a 65% national approval rate. So most people who apply with SOAR are approved, and we compare that to a less than half approval rate for all applicants nationwide. So it's about a 29% approval rate if you just kind of anybody who applies for benefits. So most people are denied, but with SOAR we kind of turned that and doubled it. And the national average is about 100 days to decision on average, which is really great. So we can get folks approved for benefits within just about 3 months. So I wanted to provide some preliminary outcomes on child SSI applications. So, most of our outcomes and our reporting has been about adult applications, which is what the focus of SOAR has been all of these years. However, we have had some providers in a few states who began implementing SOAR with children. They were serving the population, they had experience with SOAR, and were able to, translate that information into their SSI applications for children and started to track those outcomes. And so we were able to calculate a 72% approval rate on 368 decisions in an average of 106 days. So they're doing better than the national average for adults on hundreds of applications and also very quickly. So we know that this can be really effective on child SSI applications as well. So in order for SOAR to be effective and to get these good outcomes, besides having that hero caseworker walking someone through the process and submitting a quality application, we need good partners. We need partners with medical providers and mental health providers so that we have up-to-date current medical records of evidence. We need housing providers and other service providers who can work on applications. We need partnerships with the VA and key programs that serve families like SSVF, Supportive Services for Veterans and Their Families. We need collaborations with criminal justice and juvenile justice agencies who are serving this population. We need good collaborations with our education system and so that we can get key school records and IEPs and other things that are really key to supporting the kind of documentation for a child SSI application. So what we've kind of done with SOAR to help support case managers in the community is developed a leadership structure where we're training caseworkers how to do these high-quality SSI or SSDI applications, who can communicate with SSA and DDS, who can track their outcomes. But then they're supported by a local lead, someone in their community who helps to facilitate local steering committee meetings, who helps to lead cohorts through the online course and provide refresher trainings for case managers who've been trained and help to ensure quality applications are getting submitted locally. We have state team leads in every state who help to do those kind of same roles as the local lead, but on a state level. They're helping to grow and sustain those statewide activities. They serve as a liaison to all of the localities and help to maintain all of these important relationships with SSA and DDS and other key stakeholders in the process. And of course, they work closely with the SAMHSA SOAR TA Center in reporting outcomes, identifying, barriers or successes, helping us to figure out what it is that the community needs. So, our ultimate goal is to support that case manager on the ground who's helping individuals with their applications. And so how do we do that? We do that through developing leaders through our leadership academies, holding webinars and learning communities, developing other resources, supporting people through our website that has a library, our online course, our online application tracking program, all of that, and then kind of providing virtual and on-site technical assistance to communities who need it, who are implementing SOAR. And so we try to provide a really supportive environment for those case managers who are taking on, this complicated process that it is definitely hard to do. We're honest and straightforward about that, but the return on investment is so incredible. The transformations that having benefits can make for someone's life is just incredible, and so we find that investment is worth it. So I kind of went through this. This is the activities and support that the SAMHSA SOAR TA Center provides to the community. We try to really have wraparound support for all levels of SOAR implementation, whether you are a state leader or a caseworker. So one thing I will point out I didn't mention, we have a Soaring Over Lunch call, which is a monthly call where we get on Adobe just like this. We get about 75 to 85 people will call in each month and just ask questions about applications they're working on. I'm working with so-and-so and, fictionalizing their name, but, and we ran across this issue and what should I do? Or I'm struggling with getting medical records from the VA and I need some help. Or I can't get a hold of anyone at SSA. What can you do to help me make this connection stronger? Things like that. And so we love being able to kind of provide that one-on-one direct support as well as all of the kind of larger systemic level activities we do. So what is really exciting about having the SOAR online course and child curriculum developed now is we have we'll have available within 2 weeks, like Denise said, this standardized training that's available across all geographic areas that people will be able to, access any time of day or night, anywhere they are and have an internet connection. And we are going to be developing SOAR leaders who can coordinate and follow up with training and support. So right now we have a leadership academy for SOAR for adults. It's been focused on adults, and we will be offering a similar leadership academy, but for SOAR for children and focusing on the unique things that need to be considered when working with children and working with the child-serving world. And of course, the course is free. This is all supported by SAMHSA, web-based. It's self-guided. So here's just kind of some screenshots, snapshots of what you'll see. So on the left-hand side, this is the, you can see on the right, the blue, those are the classes in the course, and those are articles that are in each class. So the course is made up of a combination of videos, articles, quizzes, and a practice case component, which I'll talk about in just a minute. The thing you see on the side, this is a sample SOAR referral application for child, but it's just to show that through all of this, we have developed tools and worksheets and resources that are useful to the provider who is kind of implementing SOAR for children, so that the resources that we have had available for adults, we also have kind of mirrored and available for child SSI applications. The thing that's unique about the SOAR online course, and something that we have also incorporated into the child curriculum, is a practice case component. So you work your way through the online course with all of this stuff to read and watch, but how do we know that you're absorbing the information and that you're really understanding how to do an SSI application with a child? And so we developed a practice case, which, or two practice cases. You only have to do one. You're randomly assigned to one, where you meet this fictional applicant and you see video interviews with either the child applicant or the child's mother, in this case. You get progress notes and medical records and sample forms and sample IEPs for that fictional person, so that you can then go and complete the required Social Security forms and the SOAR medical summary report for that practice case. That gets submitted to us at the SAMHSA SOAR TA Center, and we review each and every practice case individually and provide individualized feedback to the course completer, we call them, and let them know, this was great, or actually what Social Security is looking for in this question is X. It would be really great if you could expand more on this functional area or this functional domain for this child application. And so at successful completion of the course, someone has successfully completed a full child SSI application, which is really wonderful, and we're able to kind of confirm that learning through it. So to give you just a little preview or example of what these two kind of fictional applicants. So we did both actors here. These are actors, and the cases are completely fictional. They're both adults, but the mother on the left, she's the mother of a 12-year-old boy. He lives with his mother and sister in a shelter. He's been diagnosed with asthma, ADHD, a learning disability, and generalized anxiety disorder. And so they were just evicted from their apartment because his mother lost her job, and they're at this shelter. And so the social worker at the shelter is helping him with his SSI application, and he's been struggling a lot at school and struggling a lot with his asthma, and had a lot of hospitalizations and ER visits because of that. And so you learn all about this young boy and his family to be able to do his application. And then the other practice case for Tiffany, she's playing a 16-year-old girl who is has been living in foster homes and group homes. She's now in a shelter. She's unaccompanied, and CPS is her legal guardian, and she's diagnosed with post-traumatic stress disorder, major depressive disorder, and has a seizure disorder, and so you learn all about Tiffany and what has been going on with her and what life is like for her now and what she's been struggling with. So you can do an application on her behalf. And with kind of both of these practice cases, we see how it can look different for a child like Tiffany, who's still a child according to Social Security, applying on her own for SSI, and then a younger child living with his mother and applying with her. So this is just another key component of that curriculum there. And some examples of what a scenario might look like for an individual who would be eligible for SSI, which in both of these scenarios the child would be. And I should have said when I started, I guess I just assumed that according to Social Security, a child who may be eligible for SSI is anyone from day one, from birth to age 18. So once you turn age 18, let's say you were eligible for child SSI, you have to recertify as an adult and meet the adult eligibility criteria for SSI, so it doesn't continue. So child SSI is definitely from day one to age 18, and then adult SSI is from age 18 and up. So one of the things that we do that is really kind of key to the success of SOAR implementation is tracking outcomes of applications for lots of different reasons. Not only does it help us show that the program is effective, and we can show to funders that, yes, we are helping people access income, it's getting them into housing, they're getting health insurance and connecting to treatment and pursuing employment opportunities. But it's also a great way to monitor quality. So we can measure caseworker to caseworker, agency level, local level, state level, how it's going, and if a particular caseworker is struggling with applications, seeing a lot of denials, we can try to pinpoint what's going on and how can we improve what's going on in that application process. So we have an online database that is, we call it OAT, our online application tracking, where we track all of our outcomes. It's web-based, it's super user-friendly. We don't just say that. it's just true. It's HIPAA compliant. We don't collect any personally identifiable information. It's very quick. So, in the homeless service system world, some of you may be familiar with this, but tracking in systems like HMIS can be very complicated, can take quite some time. And we try to make this as simple as possible. We just want to know a little tiny bit about the demographics of the applicant, and then tell us, when did you file the application? When was it decided? Did you do the SOAR critical components? Were they approved? And if so, for what? So that really it can be a very quick data entry, and then we can get from that a lot of really valuable information. So we highly recommend it. We've got thousands of users in the OAT system who are in there tracking their outcomes. So this is just kind of a screenshot of the caseworker dashboard where they would enter in new applications. They can see pending applications in the system. They can see snapshots of what they've done this month. They can see comparisons of their outcomes to their state and the national outcomes. So it's just kind of a friendly, free tool that caseworkers can use to see how they're doing. So I, talked as fast as I could, which maybe I shouldn't have. But to just get to some next steps and some resources, and then we can turn to some questions. So I would say, next steps for you all, learn more about SOAR. If you aren't already familiar with it, get in touch with your SAMHSA SOAR TA Center liaison. We have liaisons who are dedicated to every state, and you can reach out to them to find out, what's going on in my state or community with SOAR for adults, and how can I get involved with SOAR for children. You could reach out to your local or state SOAR leads, or register for the SOAR online course and check it out. Check out, the adult course if you're working with transition age youth and you have, some folks who have already turned 18, or they're 17 and they're going to be turning 18 soon, or register for the child curriculum if you're working with, children who are less than age 18. And I would say, I'm sure we have a lot of folks on the call who aren't doing direct service, and so, or all of you, but registering for the course and checking it out, and checking out Class 1 in both courses can be really helpful. There's a lot of good introductory material. What is SOAR? What is Social Security disability? Who is eligible? What does the SOAR process look like? And what is the time commitment of staff to do it, so that you can get a better sense of what it would mean to start implementing SOAR in your program, or require SOAR in RFA that you're putting out for a new program. Whatever it is that you might be doing or thinking about considering how this could be useful for you in your organization or in your community, kind of just getting in there and taking a look at some of the materials can be a really helpful start. And what we can put in the chat box in just a minute is the link to the SOAR directory, which you can, look up your state and kind of find your liaison, your state contact, your local contacts, all of that. So you can find that here. All right. So additional resources. So this is some of the key links, and you can access all of these links in the PDF of the PowerPoint, which is in the file box in the kind of bottom right corner here of Adobe. But our website link is there, and we'll have an announcement, and I'm sure Denise would be happy to help us share the announcement once the child curriculum is officially released. But if you go to our website and click on the online course tab, you'll get the adult curriculum now, and in 2 weeks when you click on that same tab, you'll get the option of either choosing the adult or the child curriculum. So it'll be housed in the same place. All of the SOAR stuff is all in the same place, and the SOAR for children is just being integrated into it. So it's just one comprehensive program, if that makes sense. So there's the SOAR website, our outcome tracking website. We have a number of resources that already exist for SOAR for children and youth. And so we have a really great issue brief on SSI for children. If you're just like, I just need, 5 pages to read about what all of this is, you can check that out there. Or if you're really interested in reading more about what Social Security does with youth who are aging out of SSI for children and turning adults and how that transition works, we have a great kind of 2-pager all about that if you're really interested there. Social Security's website on disability, the link is there to go kind of direct to the source if you'd like. And then the other thing that I really wanted to focus on is SSA's employment supports and education support. So a big part of our SOAR online course, adult curriculum, and also our new child curriculum is a focus on work incentives and how Social Security encourages employment and education for children. And so I just want to kind of emphasize that our goal is to find the right combination of income supports for children and their families and individuals and their families. And so whether that's working part-time, receiving some benefits, whether that's working full-time, whether it's receiving some VA benefits and some Social Security benefits, whatever that might be, we encourage people to explore all of that. And we have a lot of resources to bust myths about receiving Social Security disability and working. So you can be working and apply for and receive disability benefits. You can be working and continue to receive your check and health insurance. And we've got information about, technically how all of that works and plays out, and, real evidence about the truth of that myth-busting information. All right, so I think we should go to questions now, if that sounds good.
Thanks, Kristen. And while folks are thinking about questions and entering them in the chat box, Beth and I have a couple questions for you. First, back on the slide, I believe it was slide 14, when you said that there were select providers in Arkansas, Florida, Kansas, and Nevada that have been implementing SOAR with children, were they using the adult curriculum and adapting that for kids even before you came out with this new curriculum?
Correct, right. So the way that the SOAR model works is that we have this course which trains people about Social Security disability and how to do good quality applications, how to collect medical records, how to do functional assessments and get this information, and how to write a medical summary report, which is kind of the SOAR key component, and it makes the biggest difference between approvals and denials. And it's basically a narrative letter that we write that fully encompasses what's going on for the individual and tells their story. So, what are their illnesses and conditions? How are they impacting them? What is their, for adults, what is their work history, and how has their illness or condition impacted their ability to work, specifically, and describing how that is, and then describing their functional impairments and how really it is that the illness or condition is keeping them from being able to do X, Y, and Z, and how that relates to work. So we're trying to make this kind of full connection for the Social Security Administration and Disability Determination Services about what's going on with the person. And so these providers kind of translated that to the child SSI world. So there are a lot of parallels in the way that the process works. The way that Social Security processes an SSI application for a child and adult, it's the same. I mean, you file the SSI, I say the same. It's a little different, but it's basically the same. You're filing that application with SSA. You're using these child versions of the forms, but they're parallel versions. You're submitting medical records. You can write a medical summary report that's focusing on the child's definition of disability and the child listings. But these are all parallel to the adult. So there are lots of things that are different and more that are complicating with a child application, like the deeming of parental income and resources. This is like new information that someone who hadn't been doing a child SSI claim wouldn't necessarily know, like someone who had experience with adults. But what these providers had was that experience, and they're like, well, we're doing, SOAR for adults, and that's working great. Following this process, we can do that process with child applications. Okay.
That's very helpful. So I'm going to weave in a couple questions here from folks. First, Louise wanted to confirm that if a child is under 18, it's the parent that's signing the application?
That is an excellent question. So not necessarily. It depends on the child's circumstances and who is the child's guardian. So if you're in the kind of the average scenario where you have a child who is living with their parent and their parent is their legal guardian, then yes, the parent is the one who's signing the application for the child, but it's the child's application. However, if the child is emancipated or is married or pregnant, or if the child has a different legal guardian, for instance, if it's child protection or a county agency, that might be different who is the signatory. So there's exceptions there. There's also exceptions about releases of information and the age of the child and the state that you're in, and rules about consent to mental health and substance use treatment, and who then signs authorizations to get those records. And so this kind of technical detail we have incorporated into the curriculum to kind of tell people, all right, this is who signs this form, this is who signs this form, and if you're in this state, and it's this kind of mental health or substance use record, the child is going to sign, because they're 16 and consented to their treatment, and then, and then the parent's going to co-sign. It all gets kind of wonderfully complicated, but we try to address all of that for the caseworkers who work their way through the course.
And you have the coaches. You said you had the learning community sessions, and then you have the leads in the states, the SOAR leads, and they're there to help navigate through these thorny paths in order to help the applicant.
Yes, exactly. So if if people are working their way through the curriculum and they're like, I'm just still not getting it, or I have this particular scenario, this is what's happening with me and this person, what should I do? Yeah, so that's a role that we play at the TA Center, is to provide that kind of individualized support and individualized questions. Mm-hmm.
That's very helpful. And then I'm going to pick up on Gail's question in D.C. She asked if there was SOAR in D.C., and I put the link up for SOAR Works in the district. How, from a workforce perspective, Kristen, could child-serving agencies and systemic care leaders approach existing SOAR efforts, SOAR for adults, and ask them to develop the capacity to help kids as well? Could the same workforce help kids as the ones helping adults, existing workforce?
So I would say in most cases, no.
Okay.
And I'll say that, kind of caveat that the need is so great and the funding streams are so slight that there's just not enough capacity to serve where we are now. And so we need child-serving agencies to step up with staff time and to be able to do it. And so that's part of, work that we're going to be doing as we roll this out, is finding where can we find the right people who can reallocate existing resources and existing positions, or identify new funding streams where we can make sure that the children can get served, and that this process can get either integrated into existing programs, or to develop additional positions that could do it. So I think that in some rare cases there could be agencies that are already serving kind of both adults and children that are doing SOAR, that may be able to kind of take on some child applications too, or they're already serving family families, and now they'll feel confident to be able to do the child applications. But in most cases, we're going to have to develop capacity in the child serving world.
Can we break that down a little bit more, Kristen? So how long does it take, number one, to complete the curriculum or the course? And then second, from beginning to end, and I know you emphasized earlier that child applications are much more complex due to the multiple agencies that they deal with or involved with. How long does an application take from beginning to end for a child, you estimate?
Yeah, great question. So the course, we estimate that it takes about 20 hours to complete. So that is inclusive of the practice case component, which is one of those kind of longer parts of completion because you're really, reading all of these records, assessing it, translating it down to forms, writing this medical summary report. So, we think, it's at least 2.5 full days, but most people work on it over the course of about a month, we would say is about our average for completion from start to finish, where they'll do, a couple of classes per week. In terms of doing real applications and how much time that takes, we estimate that it takes about 20 to 40 hours per application of full development. So that is from initial engagement to final approval. So that's gathering all of the information, that's doing interviews with the child and their family and other kind of key people in their life, that's gathering medical records, writing up that medical summary report, all the communication with SSA and DDS. And the range is pretty wide there because, some individuals are easier to engage or their records are easier to access depending on what scenario it is. If it's somebody who has, been kind of consistently engaged in treatment and you have really good records, you can have a great conversation with a doctor. You're really good and solid there to get what you need. And, some individuals haven't been engaged in treatment or they're moving around, they're harder to get a hold of, and so you're doing a lot more kind of investing more time in that outreach and building that rapport and making those connections that it takes a little bit more time. And so, the other kind of complicating factor in here, when working with individuals experiencing homelessness, that can, can extend some of that time because of the instability that the families are experiencing. So.
That's helpful, Kristen. So that estimate of 20 to 40 hours, that's excluding, that's just a normal case that has not yet gone to appeal, correct?
Correct. That would be for an initial application.
An initial application. Okay. And then in the child world, we use peer supports quite often, whether it's in wraparound or system navigation, both youth and parent peer supports. There is a peer support workforce in the adult world, and I'm wondering if they use that workforce in support in developing these applications at all, and whether you see that as potential within the child's world.
Yes and yes. So
okay.
We definitely use peer supports in the adult world, and that's been, a great source of, both staffing and engagement. We find that, teams that are utilizing peer supports, have just a lot of success with engagement, and it's a great way and a great thing that we're always encouraging more. And then I think that it can definitely be helpful in the child world. We've got, resources about, family run kind of advocacy organizations and all that as a part of the curriculum. And you mentioned Fred Law on the top of the call. They're a key part of that and help provide a lot of information. So, yeah, I think that will be very useful, very helpful.
Great, thank you. That's a couple questions about eligibility. First, when it comes to children, what is the definition of homelessness?
Great question. So there are two kind of main definitions that we're working with in the SOAR world because we have adopted the HEARTH definition of homelessness, which is a very broad definition, which is inclusive of people who are literally homelessness and who are at risk of homelessness. We include individuals who are may have just been recently housed through Housing First or in permanent supportive housing or on a housing voucher, but don't have income and they're at risk of homelessness because of that. And so the definition that we use in terms of who our target population is for SOAR, that's what we use. However, the other definition that comes into play, of course, is Social Security's definition of homelessness. And they look at it a little bit more narrowly than we do. And so they're looking at a more literal definition. And the only time that matters is when they're determining living arrangement for payment amounts and whether or not someone is receiving in-kind support, maintenance. And it comes into play when they're deciding whether or not to flag an application as homeless and route it through an expedited processing that they have for homeless cases. So not every SOAR claim gets flagged as homeless. However, I would say every SOAR claim does get expedited. And the reason that SOAR claims are expedited is because we're doing complete quality applications, and when we're serving as the applicant's representative, which is a key part of the SOAR model, we're communicating with SSA and DDS. And so they're kind of naturally expedited because they're ready to be decided, they're complete, we're communicating, and they can just do their job. And the reason that applications kind of get caught up in the process and take forever to be processed is that they're incomplete, or Social Security can't get a hold of the applicant, or lots of other kind of technical things that can come up and be problematic in this pretty bureaucratic process, that we kind of work to solve those issues to help naturally expedite the applications. And I'll link to our definitions of homelessness kind of worksheet so you can see that kind of spelled out more clearly.
That's helpful. So you really emphasize the point that while the SOARs in each state, and I am looking at your website here where there is SOAR is available in all 50 states and the district, because of that recognized expertise, it makes sense for systems of care leaders to partner with them, understanding they'll need additional funds in order to expand to work on child applications as well. Is that accurate?
Yeah, I would say in addition to additional funds, reallocating existing resources. Like that's how SOAR began initially. And in the adult world, it was, we have caseworkers and social workers who are serving individuals already, and this is something that the people they're working with need. And so can we take part of that time and dedicate it to getting these benefits? Because I know when I was an outreach worker, when I could get someone benefits and into housing, it was much easier to serve them and took much less of my time than trying to maintain someone in homelessness and trying to find them new resources and services each day. So it's about kind of shifting that time as it gets started. And also, yes, absolutely essential to get connected to the existing SOAR world, because what this existing SOAR state leads can do is, help those connections with SSA and DDS. Those are going to be the same connections. Mm-hmm. And so there's a lot of overlap in that process, and it's just going to be kind of welcoming new stakeholders into that kind of SOAR process. I think it's going to be an expansion of what exists rather than a separate parallel system. That we don't want to create, two separate systems. We're just going to, welcome child serving providers into the existing.
So you really alluded to a return on investment. Have you done any return on investment analyses for adult SOAR?
Yes. I'll find the link to that. I'll throw that in the chat box too. So we have a lot of resources on funding and sustainability, and we've looked at the return on investment for Medicaid and Medicare reimbursements going back to hospitals and healthcare providers, and then also for counties and states that provide general assistance, and the return on those kind of local tax funds with SSI. So we have those on our website. We also have a guide. I can't look for the link while I talk. We have a guide on cost-benefit analysis with SOAR, like looking at all of the different ways that you're saving money. So in criminal justice agencies, we've tracked reduction in recidivism rate and reduction in time in the institution, and how that's can save millions and millions of dollars when we can get people in stable housing rather than putting them back through the system. And those similar returns will be applicable in the juvenile justice world as well, if we can get kids in stable housing as well. So in stable
we follow this call, Kristen. We follow up these monthly webinars with an email that packages up the recording and resources, so I can add the link for the return on investment resources in the follow-up email to everyone who's registered, so you don't have to try to type and talk at the same time for us. I have another question with regard to eligibility, and I know this is extremely complex and there may not be a very short answer to it, but when you're looking, what family income is considered and not considered when you're looking at a SOAR application for children?
So I'm not going to be able to answer that in the 3 minutes I think that we have. So yes, I will say that generally, if you have a child who is living with a parent, that parent's income and resources will be considered at some level. So there are steps that Social Security takes to discount some of that income, some of those resources, and they only consider part of it. And the word they use is deem. They only deem part of that income and resources to the child. It depends on the family size. It depends on where the income is coming from, whether it's income from work or income from a benefit program like TANF, or if it's income from child support. They get all of those types of income are considered differently, and it's considered differently, based on the family, based on where the family's living. It is incredibly complicated. And so what our advice to providers is gather documentation and let Social Security make all the calculations. Let them worry about figuring all of that out. That's what they're trained for years to do. And the best thing you can do is gather the evidence and the documentation and pass it on to them. That said, we do have a lot of basics and some basic examples that we've incorporated into the curriculum so that you can get kind of a general sense of, would this family be eligible at all? Like, this is what I'm looking at with their income and resources. Should I even pursue this? Is this just unreasonable or not? And so we do have kind of some general outlines. But it's always, we think it's always best to apply because there's so many exceptions. Follow up to that, or
follow up to that one, Kristen. This is Beth. Is that under Medicaid, there's that Katie Beckett provision where a child who needs expensive care, even if the family's income would make them ineligible for Medicaid, they could be considered on their own as a family of one and be eligible for Medicaid. It sounds like that is not the case for SSI or SSDI. Is that correct?
So that is correct, with one tiny exception. There is an exception for babies that are in the NICU. In order for the baby to get eligibility for Medicaid, like while in the NICU, that they'll sometimes not consider or deem the parent's income. It's a very, very, tiny exception that is rare. So I would say, most of the time, correct. It is not a family of one. It is definitely, they're looking at the family's income and resources.
Okay, great. Thank you.
Helpful. And then we had a follow-up question from Bonnie in Indiana. She's asking whether homelessness is an essential characteristic of the SOAR process eligibility, or is that a factor? To what extent is homelessness a factor or a requirement in order to qualify?
So homelessness or risk of homelessness is an essential factor for SOAR in general. So like if we are going to flag an application as SOAR with Social Security or track that application as a SOAR application, that's the target population we're looking at, is this vulnerable population. But like I said before, it's a very broad definition. So there are, so many families who are at risk of homelessness. We include families who are doubled up. We include, families who might be in housing and have no income. If they're on a voucher, they count for us for at risk of homelessness because they're living in a very unstable housing situation. So the kind of follow-up to that too is, we say anything that you learn how to do with SOAR, how to do good child SSI applications, use them for whatever child needs that help, use those skills. We just don't flag it or track it as SOAR unless they, meet that vulnerable definition.
That's very helpful. And Bonnie's typing. Let's see if she has a follow-up. Beth, do you have any other follow-up questions while we're waiting for... Oh, Bonnie says it's very helpful. See, there you go, Kristen. Thank you.
Okay, good.
Instant gratification here. That really
and I think my question got answered, Denise. Thank you.
Okay, great. Kristen, it looks like we may have one other, maybe not. Every now and then I see some typing in the chat box. Oh, here it is. As Sayeda Hall is saying, as a support partner working with families through systemic care, how would I use this course, and would this be implemented as an addition to the work? So looks like she's a peer support partner, and so have you seen peer support partners in the adult world take the SOAR course and be SOAR workers as well?
Yes. I will put, it's not the link I just put in, but I'll put a link in the chat box to our peer support information that's on our website now about kind of using SOAR with peer supports. And so this will be, mostly focused on the adult world, but I think it totally would parallel in the child world as well, child and family. So the link, I do want to explain the link I put in the box that says Sample SOAR Referral Tool Child. This is one of the tools that we have that has some basics about those income and resource deeming information, so you can get a sense of how much of a parent's income would be considered based on a family size and whether or not a family might fall into the eligibility criteria. So that's kind of a good introductory resource to that.
Great. Thank you. And I thought I saw Fieda start typing again. Yep, here she goes. Let's just make sure that her question has been answered. What would be really fun, Kristen, is to have you back, or at least check in or provide an update to the group in 6 months or so, and see where we are and see to what extent and how our systems of care are incorporating SOAR for children into their full continuum of care for their children and families.
Absolutely. I'll come back and talk about SOAR anytime you like. And we could, we can focus it too if there's a particular kind of topic or special population related that you would like to focus on, whether it's, talking all about peer supports or talking about education and employment incentives for children, any kind of piece of the process we can do a deeper dive to. This was, just a great big overview.
Another thing we could try to do, Kristen, you mentioned that you had your learning communities, your monthly calls. If you ever wanted to have one focused just on children applications, we'd be happy to advertise that in the TA Telegram, put that out to our network, and see who we could gather while we had your whole array of experts on the line for them.
Yeah, absolutely. We will. I think we will set up those like a soaring over lunch for child cases as it gets rolled out. We get more people kind of in and through the course. So we'll take you up on that.
Great, thank you. And Bonnie says, Kristen referenced a particular definition for risk for homelessness. What was that? We're going to provide its SSI's definition. Was that, Kristen?
So we use the HARF definition for kind of the SOAR homelessness, and that's one of HUD's, it's the Homeless Emergency Assistance and Rapid Transition to Housing Act. So it's through the McKinney-Vento Homeless Assistance Act that was amended by HART. Homelessness history for you guys there. So that's, yeah, we're basically using HUD's definition. We've adopted that. And then, expanded it slightly to include those individuals who, are receiving vouchers and have no income. So the link, kind of scroll up a little bit in the public chat box, there's a link for definitions homelessness that I put in there. And you can, if you follow that link, you'll see that HART definition spelled out, and then right below that is the SSA homelessness definitions and how they look at homelessness, just slightly more thoroughly.
That's great. And everyone, please know that I will have the chat box transcribed so that you'll have all of these different links as resources after the conclusion of today's webinar. Okay, Heidi, how would it work with unaccompanied youth if they did not have access to their records or documents? It's a great question.
Yeah, so an unaccompanied youth would be able to sign for their application and records on their own. So Social Security has particular provisions for unaccompanied youth, and so they would be able to access their records that way and apply on their own.
Very helpful. Thank you. All right. And now we have a corrected link up there from the Institute. Thank you, Tiara. Okay. Well, I want to thank you, Kristen.